Okay, so we're going to we've got the session now, which is going to be I think really interesting. My vested interest in is that it is research that's been coordinated and overseen by Durham University. I'm Brett, and I met Brett and Leanne. Gosh, 18 months ago in an amazing day in Durham, and we talked about some of the just some of the concepts around the research and how Social Work England could be involved. And I came away feeling just totally uplifted and really felt quite passionate about what this research could mean, and the simplicity of it, but yet the impact of it. So it's got a Northeast investment from myself. I'm the regional engagement lead. I don't think I've even introduced myself. Regional engagement lead for the Northeast of England, and have a personal interest in social work and disability. So we're going to hand over first to Matthew, and Matthew's an old colleague. We came across each other in this project, and I used to work with Matthew in Lancashire, so it was really lovely to see him again and reconnect in a different part of our professional pathway. So over to you, Matthew.
Yeah. Hello, everybody. My name's Matt Smith. I'm a senior lecturer at the University of Cumbria. And just to add that I used to work for Catherine as a manager. It gave me an opportunity to be a manager within Lancashire. So it's really great to work with Catherine again. I'd just like to say thank you ever so much for the interest you've shown in this project. To have such attendance on a weekday evening, on a Wednesday, is great to see, and it's absolutely lovely to speak to social workers again. Obviously, being a lecturer, I tend to be working with students, so to come across and have opportunity to speak to social workers is absolutely brilliant, and I'm really interested to hear all your views and comments and your input into the research that we're talking about today. Just very briefly, just a little bit about my background. Like Catherine said, I used to work for a local authority before becoming a lecturer in 2012. So I've been a lecturer for 8 years now. Prior to that, I was a social worker working within children and family services, and predominantly for most of my career in the local authority working with disabled children, which is where my particular interest comes into in working with Brett and the research team. I guess the research and the enthusiasm I have for this project is primarily around promoting physical engagement, physical activities from disabled people, and to have opportunity to develop learning resources from social workers and put into practice ideas from social workers of how we as a profession can engage and support physically disabled people, people with mental health, and people with learning disabilities, of course, to engage and use services and resources in a positive way to make a difference in their lives. So that's where my interest comes from particularly, and also as a really positive research project that highlights the commitment and the passion and the good work that we can do as a profession in social work and enriching people's lives. So that's where my enthusiasm come from, and that's why I was keen to be involved in this project. So it's probably enough for me, and I'll hand over to Brett.
Thanks, Matt. And just to echo your comments, thanks to Social Work England and particularly Catherine for supporting us on this project. What we're going to do today is I'm going to give a brief overview of how we got here, because I think that's significant. Then secondly, hopefully Catherine will be able to use her newfound technological skills and introduce a poem. And then Leanne from Disability Rights UK is going to join us and offer her words of wisdom. And then last, if we could have your questions, your thoughts about the project and about how we might move forward, that'll be excellent, because we're at the very beginning. We're at the very beginning of something that I hope is interesting and useful. And as Catherine said, I'm Brett Smith. I'm a professor of disability and physical activity at Durham University. But let me go way back to 2018, if we recall those pre-COVID times. Around 2018, late 2017, the chief medical officers contacted me and asked me to do the first physical activity guidelines for disabled people. And I said yes. And one result of those guidelines, unsurprisingly, one result was that physical activity has great benefits, health benefits and wellbeing benefits for disabled people. Chief Medical Officers also asked us to create an infographic to communicate these guidelines. And we negotiated subtly a more a co-production approach. Of course, Public Health England way back there were not interested in those types of ways of doing work, but they went with us on this idea of disabled people themselves designing and creating an infographic to co-produce, to disseminate the actual guidelines. And we did various events, workshops, knowledge cafes, focus groups, etc., etc. And we spoke with and worked with over 350 disabled people during this time, and they inputted, they contributed, they designed the infographic itself. And when I was moving around the knowledge cafes, when I was moving around the workshops, when I was moving around the focus groups, I kept asking different questions. But one question was, who do you think are the most appropriate people to inspire you, to motivate you, to encourage you to be physically active? And I expected the response to be health professionals, i.e. GPs or maybe physiotherapists. And I expected that because common in the literature, at least in my world, in academia, common in the literature, healthcare professionals are the go-to people in terms of promoting physical activity. You know, we invest a lot of money in them through moving health professionals program that Public Health England support and so on. And one thing I heard from disabled people was actually healthcare professionals were not as relevant or important to them as academics and Public Health England might see fit. And so this assumption was turned on its head. And one group of people that kept talking about as messengers of physical activity were social workers. So time and time again, wandering around these knowledge cafes, doing interviews, doing workshops with disabled people, they all kept coming back saying, no, not healthcare professionals, social workers are the key people for us who can promote physical activity. So I then started asking, why? Why are they so important? Why do you value them so much? There were many comments were shared, such as we trust social workers, we believe social workers are credible, we have lots of positive contact with them, and as one other example, they know the local communities and they know our needs. So that got me thinking, okay, well, firstly, we've turned the assumption that healthcare professionals are the group of people. So let's start thinking about social workers as potentially important people to promote physical activity. But of course, that was from the disabled people themselves. So that led us to asking the question, well, what do social workers themselves think about promoting physical activity? Are they on board with it? Or is it something that they don't see as part of their future agenda? So we started asking social workers numerous questions. And on the one hand, they were surprised about our original question about, do you think you could be valuable promoters, encouragers of physical activity when out there in the community and when working with disabled people? And they're a little bit shocked about that, partially because they've never been asked that question, they've never been trained in it, as an example. But when we pushed down and when we started asking them, well, do you think you would be useful? Do you think it'd be something you want to take to be part of? Is it something that you think is going to be useful? The unequivocal answer was yes. Yes, we think we'd be really good promoters of physical activity for several reasons. One was they quite rightly believed that physical activity was a great medium for promoting health and well-being. Secondly, it aligned with the Care Act, which I'm sure Leanne will mention a little bit more about later. If not, we can bring this up in the question and answer. But I think third, and what was really interesting, was that it for social workers themselves, it said it turns social work into a much more positive light. It's something much more productive we can do to encourage health and well-being, and it might elevate our profession even further. In other words, why should GPs be the sole arbitrators of good health? We can also contribute to it, and we can play a vital role in this. So that led us to contemplating, well, what should we really do? what should we really do? And so we asked the question, well, to social workers, are you trained in physical activity promotion? How can you do it? And the response kept coming back is, we're deeply interested in promoting physical activity. However, we don't know how to effectively promote physical activity. We're not really sure about the practical aspects of it. Could you help us out here? And at the same time as this was going on, but moving from 2018 to 2019, at the same time, Leanne from Disability Rights UK was leading a programme in which they explored, as in many ways and in many facets, the use of personal budgets to support disabled people to get and stay active. And that was the Get Yourself Active programme. And through that, they developed some guidelines for social workers to utilise to promote physical activity. We can share those practical guidelines with you if you wish, and they're on the Get Yourself Active website from DI UK, Disability Rights UK. When we spoke to the social workers who had used them, they said, oh, they are useful, but in all honesty, we'd really like something more from you. So we asked the question, well, what more do you want from us? How could we facilitate? How could we help you a little bit more on this? And the response we kept coming back was, we really need, on the one hand, to train the social workers of tomorrow, i.e. those in going through university and college education. And on the other hand, we really need CPD training for social workers right now in how to promote physical activity with disabled people. How could we do this better? So this led us to this project. It led us to Social Work England, to meetings pre-COVID, if we can all recall those joyous times, and hopefully they'll return soon. It led us to working closely with Sport England and other organisations such as Disability North, and working with disabled people themselves and working with social workers to design a research project. And that project is as follows. It's essentially two aims to it. And the first aim is to create resources for university lecturers to teach how social workers in education can promote physical activity when they go out there into the real world, so to speak. And secondly, what we want to do is co-produce CPD training for social workers themselves to learn more about how to best promote physical activity. And I stress the co-production element because we'll be working with disabled people, with social workers, with social work students, with university lecturers, etc., with Sport England and other organisations in, for example, knowledge cafes, to design what we hope will be meaningful and useful resources to teach social workers of tomorrow, those in university education and college education, and secondly, to create a CPD training programme that hopefully with the support of Social Work England, we can then roll out, evaluate, test, and to learn from, to see how we are actually doing, to see if we're making a difference. So that's the nuts and bolts of the research project itself. And where are we at is the question you may be rightly asking. Well, the first stage is we've done a scoping review, we've reviewed the literature to see what's out there. And there's very little out there in terms of social workers. In fact, we've had one research article talking about the need for social workers to promote physical activity, and that article was in 2010. But we know very little else. So what we're currently designing is what's called a Delphi study, where we're getting experts together. Feel free, if you want to be part of the Delphi study, to email myself, and we'll be asking you as experts, you with lived experience, disabled people with lived experience, about what resources, how could we create resources. We'll create prototypes, then we'll go into knowledge cafes where disabled people, university students, social workers themselves will then produce the resources that people such as Matt can utilise to train the social workers of tomorrow, and equally Social Work England can hopefully use as part of their CPD training programme. So that's a history. It's been in in all honesty, it's been a steep learning curve for me in terms of moving into the social world, learning about the Care Act, learning about everything that is going on. But at the same time, it's been an incredibly humbling experience. And certainly from what I've witnessed this week and throughout my discussions with social workers, disabled people were correct, and that social workers are incredibly important, incredibly important. So thank you for letting me be part of your incredible world.
Brilliant. Thank you, Brett. I think you've got your notifications on so we can hear you bleeping. So if you could try and switch those out, that'd be brilliant. And I think pride came before a fall because my function for forms on Teams is not working. However, I have been able to create a Mentimeter. So I'm going to get you to do some digital gymnastics, and I'm going to ask you to Google Mentimeter.com. You might just put it in the chat, or Moana, and I will share my screen. So if you just bear with me. I've gone very pink because I think it's the stress. And tell me if you can see this.
Yep.
Brilliant. So once you're into Menti, you use the code 2035 4276. How are we doing? If you can just give, oh, brilliant. So just answer the question. Maybe not as slick as a Teams poll, but not bad. Got 26 responding. I don't know how many are actually on our on the session today. I guess not everybody will do the poll, but if you can, that would be brilliant because this is going to be really important information, I think, for Brett and his team. Okay, I'll give it a few more minutes. I think we've got an overwhelming yes. Be interesting to have a conversation about the yes and the no's, but yeah, I think so. We've got 51. I might. Another no. Hopefully most people have been able to access the Mentimeter. Okay, I'm going to move to the next question. There's only 4, and I'll move into the next one. Do you think knowledge about how to encourage physical activity should be embedded in university, college, social work curriculum?
Catherine, there's a question about whether this is for social workers in all fields.
Brett, do you want to answer that one?
The answer is twofold. Yes, but equally, I'd really like to hear people's views, perhaps later down the line, in terms of the subtle differences, so that we can start having a much more informed conversation about how we might tailor physical activity promotion in respect to that. So yeah, that again, these are types of comments and thoughts that we desperately need to move forward, so we can make much more informed decisions when we're crafting and creating the resources. So thank you.
Well, I'll go on to the next one. Do you think there should be a CPD training option that focuses on physical activity? Great. And I think I will move on to the last question, which is how confident would you describe yourself in terms of raising physical activity with your clients, service users, people that use your service, or people that you work with? Brilliant. Thank you so much for getting involved in that. Brett, do you want to sort of pick up? I can go back and see the scores, or do you want to make any comments, or do you want to just to close the Mentimeter?
If you can close it, that'd be fantastic, Catherine.
Okay. We can save a copy of that, and yeah, so that's I'll exit.
Thank you for everybody responding. I mean, firstly, it gives us some confidence to move forward with this, and the questions will help really to get to the nitty-gritty of everything. And the idea of the confidence one, I think, was really interesting for us. Later down the line, we'd be very much interested in why people are very confident and why people are perhaps less confident, because again, that knowledge, that lived experience that you bring to it will be just incredibly useful on that front. And I'm literally scribbling down notes as we speak on all the multiple great questions. So thank you all. And right now, I'm sure you've heard enough of me, like most of my students do during the day. So I'll pass over to my wonderful colleague, Leanne.
Hello, everyone. Sorry, never had so much trouble unmuting myself. It's great to be here. Thanks for having us, and thanks for giving up part of your evening to be with us this evening. So I just want to start, I'll just give you a quick intro to myself. I work for Disability Rights UK. I've been working with Brett for some years now, which on various projects which he's already described. We work on a project called Get Yourself Active at Disability Rights UK, which is funded by Sport England. I came into Disability Rights UK to run that project, and it's just been an absolute delight. My background is I trained as a social worker back in 2009. That was when I qualified, and I fell into the voluntary sector, into the world of user-led organisations and community-based micro enterprises, and kind of slowly made my way into working in a national organisation, which is a user-led organisation, as some of you may know about Disability Rights UK. My colleague Liddy is here with me as well. I'm not going to make her introduce herself, but she's waving. So what we're going to do, I'm just going to kind of talk you through, I guess, some of the context of our work and how it can be applied, I guess, around social work in real life. Just so that you know that we've considered real life stuff, you know, the ways that you might apply this newfound knowledge or not so newfound knowledge, and how you can support others to do so. What would be great though is after I've done my bit, because we'll open it up for questions, is if you could put your questions in the chat box. We think it might be a little bit hard work kind of taking questions verbally, if that makes sense, but if there's a reason why it's difficult for you to put it in the chat box, fine, stick your hand up and we'll address your question. And Liddy's going to field the questions, because we have no idea how many we're going to get. So we'll do our best to answer all of them. And if we don't answer all of your questions, we will answer them afterwards, and we'll find a way of getting those answers to you. So on with my bit. As I said, we've been working with Sport England since 2015, and our work has been about exploring how disabled people can have more choice and control over getting and staying active. And so at this stage in the programme, which is our kind of second round of funding which we've received from Sport England, is that we've developed evidence to back up some of the assumptions that we were making in the early days of the project. And this has been done actually in partnership with Brett and Durham University over the years. So just to give you an idea of what our assumptions were at the time, back in 2015, was that we thought that disabled people's user-led organisations and community-based, voluntary sector, non-sport sector organisations were really well placed to shape and influence the way local people get active. We also had a hunch that if the physical activity sector had stronger links with those organisations and understood the value of engagement and co-production, their offer would be more attractive to disabled people and people who are less active. And then the third one, which is, I suppose, more interesting to you guys, is that social work and other frontline social care workforce could act as key messengers about physical activity to disabled people and others they were supporting. So really sort of around this time, this is before we met Brett, and so we were kind of on a parallel path towards some realizations together, and it was really, really lucky that we came together when we did. One of the unique things about this project and the approach that we were taking at the time was that we were testing these assumptions through personal budget holders. So we wanted to see if our approach to influencing different parts of the system, so that would be through individuals, the sports sector and social workers, whether that would mean that people could at least utilise the personal budget process, i.e. the assessment, the support planning and the review bits of that process to increase the likelihood of physical activity. We tested this out through our partners, local partners who are also disabled people's user-led organisations, and we'd put a lot of thought into this before we went for the funding. It actually took us about 3 years to convince Sport England to let us give it a go. I wasn't around at that time, but I understand it was hard work, but we had done a lot of thinking about it. So we'd engaged with organisations that ran self-directed support services, and we've worked with national policy colleagues, and we also have our own experience of running a national personal budget helpline, and so we receive feedback from disabled people on the personal budget process very, very regularly. And we found that whilst there were funding constraints, which we're all aware of at the time and even more so now, it's important to still advocate for physical activity to be written into the support plan, ensuring that it was recognised as a way to meet outcomes. And we very much found that through the project that we worked on together with those DPULOs. So we had local coordinators working with local disabled people who wanted to be more active or needed more support to be more active, and we were then also working with people social workers as part of the personal budget process, and we came to some really interesting conclusions about what that would mean in practice if it were to be rolled out, and some of the things that Brett has said, which he found through the development of the physical activity guidelines, all chimes together really, really nicely. So I'm just going to touch on the Care Act, because I know that this will be for a lot of you part of your day-to-day work really, but obviously it states that in all social care work and decision making, local authorities must take into account persons' well-being. And as you know, it's about people's needs and outcomes being met rather than the services that we put in place to make those happen. Well-being is a priority in the Act and considers the many ways in which this principle can support independent living. And the Care Act continues to be a key piece of legislation which helps us at DRUK to influence decision makers, funders around independent living, but it also helps us to remind government of the history and importance of this legislation, which really has kind of grown from the disability rights movement, and this is part of our broad mission at DRUK. So our work with social workers in physical activity promotion helps us to create an ever stronger case for better implementation of the Act, and that's something that is very, very important to us, and we thank all the social workers that have helped us with that over the years. So that's our sort of I guess the social care-ish type context. I'll now talk a bit about working with a sector which was completely new to us when we started doing this work in 2015. Completely new to me. I come from the social care, the community sector world. I do not come from the sports sector, but working with Sport England has been really interesting. And at the time, Sport England and other key players in sport and physical activity occupied their own space around promoting physical activity. So this meant that Sport England was tending to fund sporty organisations like leisure providers and community clubs. And the way that they talked about impact was about bums on seats or how many people were turning up to a session. But since then, Sport England has been on a really interesting journey and created a path over the last few years towards a more cohesive and collaborative approach with social care, health, voluntary sectors, voluntary and community sectors. And I think that's a lot to do with their movement away from KPIs towards a more outcomes-based approach to tackling inactivity. So this has enabled us to influence change for stakeholder groups we represent at a national and local level, and it means we've been able to effectively argue for social workers to be considered as a crucial part of the wider system to help tackle inactivity. As Brett mentioned, GPs have tended to be the go-to profession in believing that a lot of physical activity promotion can happen through them. But actually, I think what we're all learning is that we all have a part to play as part of a bigger system, and there's certain parts of the system that may have been overlooked for many different reasons, and so that's why we're so passionate about working with social workers. We also believe that social work is, because of the profession of social work and the way that it works, is key to making all of this happen, to promoting physical activity to disabled people and inactive people, because you're there to enable people to have choice and control over the way they live their lives. And ultimately, being active helps you to live a healthy life. It increases your well-being. It reduces other health impacts. But more importantly, people have fun. People enjoy themselves when they're being active, particularly when they can be active with their friends. And that sort of stuff, that's the feedback that we've always received, is that that's more important than anything to people when it comes to being active. And social workers are trained to engage with people and use empathy and critical reflection, as well as, you know, all the evidence-based tools that we're taught to understand a problem, as well as develop strategies and approaches to fix that problem. So it's such a really, really important foundation to be working from when you're talking about promoting physical activity. And really, when you're talking about promoting physical activity, it's not necessarily the physical activity itself, it's what people are going to get from it that's the most important. So Brett has talked a bit about the guidelines that we created in 2017, and that was to support social workers to have conversations about physical activity. And we rolled those out to 135 social workers across the country. And we did that via short training sessions in team meetings, and we did an evaluation which helped us to further understand the real life social work context that we were trying to influence. So I won't go into the details of the findings. I think Liddy put a link up for you to access. It's on our website, but we can send all of this in a follow-up email as well. Brett has talked to you about the fact that social workers were telling us, yeah, we want to do this, we want to promote physical activity, we see the importance of it. but we probably need a bit more confidence and support to do it. But just to take you through very quickly, because I'm eating into our Q&A time now, is to talk you through some of the barriers that we know that social workers face. So say you've promoted physical activity, you know what you want to say to someone, and they come back and say, actually, yeah, I do want to be active. Where do you start with finding opportunities for people at a local level, particularly when your whole work life is spent looking for other ways to meet people's needs? So we recognise that as quite a significant barrier. And even if you do know where to look, chances are that there's probably going to be limitations in local provision, and that's kind of part of what we're trying to do, is to shape that local system so that people can access the right physical activity for them. Also, social workers told us that for the people that they were supporting, that there was a reluctance to engage in physical activity opportunities, and that I'm sure many of you will be aware of those reasons. Why are people reluctant to take part? It's because disabled people are often told that physical activity is not for them, either through media, through people saying things at school or in clubs, or just through really bad experiences of physical activity, and also just through fear of what will happen to their benefits if they're being seen to be active. We've had all sorts of feedback on that from people. And then there was another barrier. These are not all of them, there's quite a few, but there's funding concerns, that people can't afford to be active, or that people can't use their direct payments to pay for a gym membership, which is that's the usual example that people give when they're talking about how they're going to be active. So it's just that one links back to the awareness of what's actually available and how people can be active. People can be active gardening or going for a walk with their mates. So there's lots of different ways that they can do that. So I think I'm probably gonna stop there, because we're losing time swiftly. There was a few things that I wanted to mention, but I can probably forward some of those on to Catherine or others to see if we can send them out to attendees. So I just want to give everyone opportunity. I don't know if we've had any questions so far in the chat box, but please do start posting them, and I'll hand over to Liddy for a sec, if that's okay.
Yeah,
There is a question, Leanne.
got a bit of
There was
feedback.
one question, Leanne, for you whilst you were speaking, from Catherine. She said her son had completed a degree in exercise and sports science at Exeter University, and she wondered if they could be a useful stakeholder. Sorry, Lydia, I do apologise.
That's okay.
That's anyone that wants to work with us is a useful stakeholder. Please, yes, yeah, absolutely. Yeah, if we can somehow be put in touch, that would be really brilliant. Maybe we could put our email addresses in the chat box for you, and so anyone who's interested in taking part in this somehow, or just wants to be updated on it, please get in touch and let us know, because we really want to tell you more about it. Sorry, Liddy.
That's okay. I was just going to say we've had quite a lot of kind of positive feedback in the chat box that I've been looking at. So someone said, I think now is the time to focus on this, as we have had to start thinking and working very differently as a result of the pandemic. So that's a really good point there. And we've also had quite a lot of really positive examples already of kind of people, social workers supporting people to be active. So Laura said that they've used personal budgets to purchase a treadmill for someone during the pandemic, as they were unable to access the gym and were shielding, so couldn't go out, but had an underlying heart condition. So they managed to think creatively to meet their needs. So that's a really great example there. In terms of questions, so we've had one from Stephen. He said, is it not about having the conversation, so raising the profile of what being physically active can do for you in terms of well-being, not necessarily saying do this thing or that thing, so more sowing the seed. Anyone want to comment on that?
I'll jump in first, and then if Leanne has anything to offer. Its long short answer is you're fully correct. No one really likes to be told you must be physically active, and I think the disappointing aspects and conversations I frequently have with Public Health England and the chief medical officers is they always think physical activity equals good health, that people do it just for their health. Most people don't start off for their health. They do it because it's fun, it's enjoyable, it gets them out of their house, it does other things, and health is a byproduct of all of that. So you're correct, and these are the types of conversations that we want to have, and secondly, to learn from, so that we can embed them all in this training. And so I've got already created masses of notes, and I think you've already accelerated our knowledge to embed in the training as we move forward. So thanks. Yes, is the long and short answer is.
Brilliant, thanks, Brett. So we've had a couple of comments, so not really questions, but more concerns that have been raised. So Louise has said, my concerns are about the possibility of exercise being encouraged when not appropriate, or people being penalised for not taking part. So, for example, conditions such as chronic fatigue or in the ME communities. And then someone else has also echoed these concerns. So they've experienced social workers and other professionals not understanding particular health conditions or disability, and that this can mean often offering unhelpful advice. Does anyone want to kind of comment on those concerns at all?
Yeah, I'm happy to,
Yep,
if that's okay. It's just absolutely. I mean, I think it's crucial when, as many of the comments have said, when we're working with service users, with people, we listen to them, don't we? We understand what their needs are, their particular wishes and desires, and what they wish to do. So that's obviously a key value that we have as social workers. So that's the starting point, and I think that's really important when we're thinking about developing training and education in this field. Is we look at some of the processes we have as social work, assessment, care planning, and how these can seamlessly fit into the conversations that we start having with people in the assessment stage, and engaging and listening to people. So absolutely, it's about choice, isn't it? It's about the rights of people as well, and it's not about forcing this on people, and looking at creative ways of promoting different forms of physical activity and the social benefits of that as well, of course.
Brilliant, thanks, Matthew. We've just had a comment come in saying, plus the facilities and venues of centres, groups and pools are generally not disability friendly, which is obviously an issue when people are kind of promoting physical activity. Does anyone have anything to comment on that?
Yeah, that's what we hear all the time at Disability Rights UK, and obviously part of our role is to take those stories, those problems, those comments, and trying to influence at a national level to make change happen. But that doesn't happen quickly enough for people on the ground. Yeah, the sad thing is that there are many venues that are inaccessible, and probably more so as venues will start to reopen during the pandemic, and as restrictions ease, because of the I guess the loss that the sports sector will have faced in income, and so it's probably slightly less likely to be able to offer accessibility approaches, and not just in terms of like the built and physical environment, but attitudes and approaches and the way in which you welcome people. Often our work is about trying to get that at the top of sports sector leisure providers' agendas, and it doesn't always sit at the top. It might sit at the top at one moment in time and you think you cracked it, and then it falls down the bottom again because the global pandemic hits. But I think for us, we don't just focus on leisure providers, sports in the traditional sense. it's about moving more and being active in a way that's right for you. So as I alluded to earlier, that can be taking a walk around the block with your friend, or a walk or a wheel. It could be doing obviously an exercise video in your living room. It can be so many things to so many people, and I think the key is about drawing that out of people and kind of understanding what that means in their world and their context. And that's been some of the things that we've been trying to influence the sports sector on, is that this is not the only way that people can be active, wearing lycra and, you know, taking part in team sport or whatever. It's there's a whole world of things that you can do out there.
Great, thanks, Leanne. We've just had a really good example come in from Catherine, who supported, been involved in taking an elderly man out to play a game of tennis, which was set up to give his wife, who was the main carer, a break, but both got tremendous benefit from it. And she said he has dementia but retained how to play tennis. So I thought that was a really nice example there. So in terms of, we haven't had kind of loads more questions, more kind of comments, but someone's put, I think it depends on the workload, time, availability, and social workers' fitness as well. So they said they are sporty themselves, and I've always believed in the idea of physical activity and that it can help, but each individual is different. Does anyone want to comment on that? Or?
We did have that some of that feedback when we did the evaluation for the social worker guidelines. A few people said, well, I don't really feel that comfortable with promoting physical activity because I'm not active myself, and I feel like I'm sort of a bit of a fraud, really. And so this has the double benefit in a way, this research, because it also, I mean, for me, doing this work has helped me to realise all the amazing outcomes that being physically active can bring to me personally. And as I said before, for me, it's about having fun and de-stressing and unwinding, and for other people it's different things. And so I think this process, the process of the training that we're developing, the education program that we're developing, we really want to have a sort of element there which is about social workers as well, because you're important too. It's important for you to feel that you can get something out of being active as well and find ways to make that happen in your day. But at the same time, you know, it's only if that's what you want to do. It's really not a sort of message that, you know, you have to do it. But if it's going to help you in your life, then that's great too.
Brilliant, thanks, Leanne. We've kind of had that echoed in the chat box as well. So someone says the activity does not need to be sporty. It can be anything that encourages the person to engage in an activity which requires range of movement. And we also had a comment a little while ago about lack of personal budget. So Kathy has said she's a social worker in the voluntary sector, so signposts people to activities and helps colleagues to find activities that can help their well-being and physical health. But there are an issue with lack of personal budgets at the moment. So obviously that's going to have a bit of an impact on where to signpost and how people can get active. Does anyone have anything they kind of want to?
Can I just make a comment? I've been really enjoying reading people's practice guidelines and practice ideas, and I think perhaps that's what it's sort of meant to me, is the focus on creativity from social workers to think things through and engage and work with people. And I think that's central to what we're looking at here, is promoting the idea of thinking about this and encouraging social workers to be as creative as possible. I know there's always issues with budgets, with resources, time, workload, and those areas. But I think by, you know, talking about these areas and thinking about not physical health as, you know, the illness that somebody has, as a disability, but we're thinking about wider and a more positive note, and the creativity really shines through for the comments. And I think that's given me a lot of pause for thought in terms of how can we promote educational resources or prompt conversations about that, and about not being constrained by our own processes and procedures in our workplace, wherever that may be, but thinking outside the box a bit where we can.
Brilliant.
As
Thanks,
Ali said,
Matthew.
as Farsi says, creativity is key, not budgets. Much better put
Yeah.
than I have, much more succinct.
We haven't really had any other questions come through apart from Christina, who said, this might be for you, Brett, can you provide links to research and guidelines?
Yes, Liddy, you've got the guidelines, the social worker guidelines. You've also got the link, if my memory serves me right, to get yourself active for the CMO guidelines, and we can share a link regarding this project. And as we keep saying, please do contact us because we really want to gather more of your knowledge, even if it's for 30 seconds, a quick call, quick email. This is incredible, so thank you.
Thanks, Brett. So we just had one come in, which is it's a bit of a concern of someone. So sorry to be looking at the downside. They said, my concern is when and if this task gets linked to performance of social workers, those social workers who are not very physically active or not keen on this task might be at a disadvantage if organisation links the task to performance. I don't know if anyone wants to take that, Leanne.
That raises a really interesting point in that we need to think about social work at various levels within an organisation or a local authority. So we're not just talking about educating social work students as part of their training. We want this to be part of CPD, and that includes social work managers. It also includes engaging with those who are kind of making the decisions about performance indicators for staff, for social workers. And that is the last thing that we would want, is for anyone to be judged performance-wise on how, if we started counting how many people started being active as a result of conversations that have happened between social workers and creating that sort of environment, that would be going backwards, and that's exactly not what we're wanting to do. This is part of your toolkit. I think that's how we would like to view it, and if you can utilize it, that's brilliant. I think that's where we're coming from.
I'm probably going to have to jump in and say we've got 1 minute left, so that is amazing. I think we could keep going. So probably need to just wrap it up, if that's okay. I'll just put myself back on video. As I say, I think, we have a sort of a background chat so that if anything technical goes wrong, anything, but actually we're saying how engaged this session has been and how people have been really willing to share their experience and comments. So just for reassurance, Brett and Leanne and Matthew and Lydia will be able to print out the comments, so we'll be able to give you a copy of that. So yeah, I'm just conscious that people might need their tea, and my face is getting redder and redder, so I would like to not be on the camera. But just thank you so much. Thank you, the four of you. I think it's been a really interesting session, and as I say, by the evidence of the chat, people have really thrown themselves into it. And as I said, Wednesday evening at 6 o'clock is not an easy time. So thank you all for that.